Allen Rolleri, publisher of Hotel Business, and welcome to Expert Insights, the video edition. Expert Insights is a platform for industry leaders to educate you, their peers, on important solutions to help your business succeed. Today, I'm pleased to be joined by Joseph Latino, president of Allergy Technologies, who will be discussing a major health concern to guests and hotel employees during and post-COVID-19. Joseph, welcome.
Thank you, Alan. I appreciate this opportunity to speak with your listeners. We are truly living in unprecedented times and navigating through some really uncharted waters. COVID has changed the way we think about hospitality overall, and ensuring the best possible guest experience now places an even greater premium on guest and staff safety and well-being.
Absolutely. So, Joseph, what has COVID-19 caused in terms of public health pests in hospitality? And looking at this and down the road, what are the present, near-term, and long-term implications?
Sure. With the advent of COVID-19 guidelines and concerns about transmission between guests and staff, many services hotels normally require for safe and sound operations have temporarily been suspended. Specifically, pest control has been determined throughout the country as an essential service, but many, if not most, hotels have reduced their services to barest minimums, often just in response to an emergency. Delaying treatment and the failure to implement preventive programs simply worsens the inevitable. Absence of pest control, hotels are now becoming a fertile ground for bedbugs and roaches and rodents. Before COVID-19, hotels benefited from daily inspections by housekeeping staff, the eyes and the ears of the property, alerts from guests, quick action from their contracted PMP or pest management operators to treat pests like bedbugs and rodents, roaches. Now, those early detections are less likely. Probably timely treatment by PMPs may not even be available. And untreated, these infestations are going to quickly grow into grow exponentially and will spread throughout the properties. Just to give you an example, Alan, a bedbug in 70 days, one pregnant female can create over 30,000 bedbugs. In just 3 to 4 months, a roach population can multiply by over 600 times and will continue to expand without a periodic pest control maintenance and proper cleaning procedures. The core message here is that we need to strike the right balance between preserving public health through preventive and focused pest control while not causing undue exposure risk to clients during the COVID-19 pandemic.
Right, absolutely. And to that, we've reported here at Hotel Business that hotels are being repurposed to become centers for COVID-19 patients, essential workers, etc. And that's really great that our industry is doing that. But, what public health pest concerns does that raise?
Hotels are increasingly, as you say, being repurposed as locations for the homeless, quarantine sites, temporary housing for healthcare workers and first responders. Public health pest introduction will undoubtedly rise substantially without implementing prevention and effecting timely treatments. And this is going to cause undue harm and stress to the occupants and the staff, while resulting in a really extensive operating remediation expense. If you think about bedbugs, which is something that's near and dear to our hearts, compounding the problem is that bedridden COVID-19 patients are prime, unmoving food sources for bedbugs. This is terribly and especially worrisome, as recent data now shows that bedbugs may actually contribute to asthma and breathing complications. And then we have the other pests like roaches and rodents, which if left unchecked represent an increase in potential introductions of viral, bacterial infections and diseases, while adding to the burden of allergens.
Yeah, and with all the respiratory issues with COVID-19, this is a major problem. So how is this impacting guests, hotel brands, and ownership?
Right. Well, in the absence of and this industry term, integrated pest management, In the absence of IPM-based pest control, bedbugs and other public health pests can spread throughout an entire facility, a hotel, over a several-month period of time. And without prevention, this results in difficult, extensive, and costly treatments. It significantly disrupts the facility throughout the entire facility. It causes unnecessary and prolonged interactions with the pest management company, which is especially problematic during today's COVID pandemic. In addition, you have social media, and those posts citing public health pests in hotels further damages brand reputation, okay, and worsens already depressed hotel census. And unfortunately, ownership may actually incur legal liabilities from the results of these events.
Yeah.
It's a pretty widespread effect.
So I think we have a really good baseline and understanding of how important this is. So Joseph, talk a little bit about the big picture concept that the industry should be implementing right now.
Of course, for hoteliers, bed bugs remain the single most difficult pest to control. They reproduce at extraordinary rates. They're difficult to detect. They can go extraordinarily long periods of time without a meal, offering hoteliers that false sense of security that they've been eliminated. Adopting a preventive strategy now can potentially save hundreds of thousands of dollars in unwanted treatment costs. Certainly, under using well-established COVID-19 hygiene guidelines, PMPs can implement field-proven preventive programs that will significantly reduce their bedbug incidence. These proactive measures will ensure the well-being of the occupants, the residents, the guests, reduce operational expense. They'll protect facilities against expensive remediation costs. They'll reduce ownership liability from bedbug-related legal costs or legal activities. But most importantly, negative social media posts impact brand reputations and have proven to result in reduced census and lower room rates. Instituting prevention can ensure bottom line growth by preserving brand reputation. Allen, if hoteliers are unable to institute prevention right now, they should consider implementing it with COVID-19 restrictions relaxed, and hotels are undergoing sanitization before returning to normal guest service. They should seriously consider a hotel-wide assessment, including bedbug detection, treatment if there are any underlying problems, and implementing some of these field-proven strategies, preventive strategies. These measures are significantly easier to enact, less disruptive, and certainly less expensive while the hotel is unoccupied.
Right. Well, one of the things we're reporting so much right now, and I'm sure you're seeing it in the media, is how important it is that there's transparency with the guest as far as their safety, their health, their wellness, all right? So all of these are going to be so important, always been important to our industry, but more than ever, that transparency for the guest is going to be so important. And that's why you're seeing all of these different programs being launched geared towards guest health and safety. And this is going to be a big part of that. So to that end, what specific measures should our community be taking right now in terms of prevention?
Well, prevention is a term we need to define based on the public health pests we're addressing. With rodents, for example, every effort should be given toward directing timely garbage, timely garbage removal, and ensuring that sanitation measures are strictly adhered to. External building perimeter review should identify and repair any means of ingress that may be through a breach of construction that may be at the perimeter of the building. Similarly for roaches, sanitation is key, okay? With periodic application of gel baits, okay, that are field proven to be effective for 3 months. These are all medium, short, and long-term solutions. Bedbugs typically cause hoteliers to shudder, given their difficulty to control and the far-reaching expenses to eliminate the problem. And effective prevention can be attained simply through installation of active mattress liners, of which ActiveGuard is exemplary, on the box spring, application of desiccant dusts, voids. The process probably, Allen, takes less than 10 minutes per room and will provide excellent protection for two years against any newly introduced bed bugs and preventing them from transitioning from simply an introduction, which we cannot prevent, into a full-blown infestation. Our data extensively demonstrates that bedbug prevention, this particular bedbug prevention process, can successfully reduce bedbug incidence requiring treatment by anywhere from 80 to 95% or more.
Oh wow! So that's
a key.
A large number. So our industry is, and I think you'd agree, we're an industry of optimists, right? That's we're the hospitality industry. So it's been really refreshing talking to people in the industry, and a lot of us are looking at this as a time to reset, evaluate, and really improve practices. So, how do we as an industry heal, rebound, and ultimately, reach new heights in what we do?
Every so often, an event causes an industry to reboot, okay? Kind of shake off the confines of the paradigm that it was stuck under or it was working under previously. And I strongly believe, and I believe that listening to you, you do also, that COVID is such an event. We've all been sheltering in place to prevent COVID from spreading and avoiding infection and treatment. I mean, that's the social condition that we're all trying to protect ourselves, our family, etc. But we also know that without prevention, the COVID situation could be much worse. Okay. Yes, it was recommended by the industry that hospitality react to treat public health pests in a kind of reactive measure. Have the problem, treat the problem, rather than seeking a preventive approach. Fortunately now, we have field-proven methods that can significantly reduce and prevent public health pests. However, Alan, we can't be short-sighted. Studies show that the industry greatly underestimates the true costs and overall financial and social impact of these pests. And the industry has to finally accept, and maybe they will now, the overall financial and social impact of these pests, and that the value that prevention is appropriately should be affixed to that. Prevention has tremendous value, okay? But it has to be seen in comparison to what the cost otherwise of doing remediation is. And as COVID abates and hotels reopen and ramp up operations, I believe that hotels should start to actually embrace prevention now and reap the long-term benefits of an improved bottom line, preservation of brand rep, heightened guest satisfaction and retention, while enhancing stakeholder equity. This is the time for us to really reevaluate and put ourselves on a different path, a preferred path, a better path.
Absolutely, couldn't agree more. Believe it or not, we are actually out of time. I want to thank our community for checking out this content. We will be providing the contact information for Allergy Technologies at the end of this interview, so please feel free to reach out directly if you have any other questions. And Joseph, I want to thank you for sharing your expert insights with us today.
Thank you, Alan. It was a pleasure. Be well, be safe.
Same to you.